And welcome back to the Morning Blend. We were transforming your health with Columbia's St. Mary's, part of Ascension. Diabetes remains a major health problem with close to 30 million Americans living with the disease and 86 million with pre-diabetes. Many of them don't even know they have it.
Yeah, and although there is no cure, it is possible to bring it under control before the onset of complications such as kidney failure, blindness, and even limb amputation. So joining us now is Dr. Carlo Galvao with Columbia St. Mary's. Great to see you this morning.
Thanks. It's nice to see you too. Thanks for having me.
The numbers, I think, are shocking. Close to 30 million Americans living with diabetes and about 86 million are pre-diabetic.
Right. Yeah, it's quite remarkable. A lot of people with diabetes actually won't feel anything, won't know they have the disease. The same is true for people with pre-diabetes. They won't feel anything, they don't know they have the disease, and they can have, the longer they have pre-diabetes, the more likely they'll develop complications of the disease. So it's quite remarkable. If you take, say, certain ethnic groups, for example, Hispanic Americans, Asian Americans, about half do not know they have diabetes, which is quite remarkable.
Wow.
Yeah.
So what are some of the symptoms? Well, first tell us a little bit about what diabetes is. I know you can't break it down to small, but what it is.
I think, diabetes is a condition in which sugar builds up in your blood because your body does not make a hormone, a substance called insulin, or your body resists the action of insulin. I think a nice way, an easy way to think about this is to imagine a bunch of cars trying to come up a driveway to enter a garage. The garage is your cell. And the cars are kind of the molecules of sugar trying to get into the garage. So the insulin is the garage door opener, is what opens the garage to let the sugar get in. And if you don't have the garage opener, so you have this backup of cars in the driveway, which is the sugar that builds up in your blood. So it's a kind of analogy to what happens in diabetes.
Yeah. And so what are the symptoms? So the pre-diabetes thing, that scares me a lot because it seems like the numbers are going up as the years go on with people diagnosed with diabetes, but no one knows they have it.
Yeah, pre-diabetes is especially associated with obesity. So we have an epidemic of obesity in this country and actually throughout the world. So the numbers of prediabetes have increased significantly in the past few years. So prediabetes, most people won't feel anything at all. People with diabetes, as I said, again, sometimes they may have, they may be urinating more, they may feel hungrier than usual, they may be waking up in the middle of the night to urinate, they may have some visual changes. But I think the message for the people watching this at home to keep in mind is that most people, again, won't feel anything at all. And that's the tragedy of it because, even though you don't feel anything, blood sugar is building up in your body and causing damage. So often people present to the doctor with complications already, advanced complications from the disease, from the condition.
And I want to talk about what happens, what those complications are and what happens when it's not treated. But, you mentioned something earlier about people not knowing they have it. Should people have a regular test to see what their blood sugar level is?
Sure, absolutely. I think, again, just because it's important to catch the disease early enough to prevent complications. If you catch someone with prediabetes, you can prevent them from becoming diabetic. You can prevent them from evolving to diabetes. And if you diagnose diabetes early enough, also you can prevent the complications. And the complications you mentioned a little earlier are, for example, heart disease and stroke. People with diabetes have double the risk of having a stroke or heart attack.
Wow.
Blindness is the other complication. The high blood sugar damages the little vessels in your retina and the back of your eye and can lead to blindness. It also affects your kidneys. It can lead to kidney failure and the need for dialysis. And it can also affect the vessels of your lower extremities and cause amputations, damage your nerves. So all of these are kind of complications of the high blood sugar.
Wow. And if you feel fine, do you just go to your doctor, or if you're not particularly that obese or overweight, should you just say, hey, test me?
Right. So everyone who is older than 45 and older should be tested.
Oh, wow.
I think those are the guidelines of the American Diabetes Association now.
Okay.
Or if you're kind of like your BMI, the body mass index is above 25, you're a little overweight or obese. In other words, if you're kind of round around the waist, you have a little chubby, or you have a big belly, and you have a family history of diabetes.
Okay.
If you belong to certain ethnic groups, like Hispanic Americans, Asian Americans, African Americans, if you have a heart disease or hypertension, high blood pressure, if you have diabetes during pregnancy, or if you're not active more than 3 times a week, you should be tested.
Okay.
So those are the people that.
Interesting. 45 years old or older,
Yeah.
so that starts fairly early.
Right.
And it's important to kind of mention that there are 2 different types of diabetes.
Sure,
A lot of people are familiar with type 1, which often is diagnosed in kids,
Right.
but type 2 is sometimes related to a lifestyle diabetes.
Right, that's right. Yeah, there are several categories. The 2 most common types of diabetes are type 1 and type 2. And type 1, people actually cease to produce insulin, that garage opener we're talking about. So they need insulin to survive, most people with diabetes type 1. And that is actually the minority of people. About 5 to 10% of people with diabetes have type 1. Type 2 is far more common. 90 to 95% of people with diabetes have type 2. And that is the one that, people actually make some insulin sometimes, but not enough to control their blood sugar. So, it's kind of, you can think about this as sort of the garage door kind of malfunctioning, or the garage door not opening the door all the way. Exactly. And so.
Important for people to get tested and know the risks as well as some of the symptoms, because you may have it and not even know it. So thank you so much, doctor.
Absolutely.
We appreciate your
Absolutely.
time.
Yeah.
You should talk to your doctor about prediabetes and diabetes, and if indicated, be tested early. Prevention and early treatment are key really to preventing diabetes and also reducing the risk of complications. So for a full list of Columbia St. Mary's clinics, you can visit columbia-stmarys.org, or to locate an internal medicine or family doc, you can call 414-332-DOCS. Thank you so much.
Thank you so much.
Information.
Yeah,
Thanks so
really
much for
good.
coming.
Thanks a lot.